The treatment of the lupus depends upon the symptoms you have and the type of organ involvement you have and also the severity. And sometimes if you have any comorbidities, we may have to adjust the medication as per the comorbidities as well. So the basic treatment is mainly the immunosuppressive medication, because as you know, in lupus you have immune cells are altered or they are abnormally overactive. So we are trying to suppress the immune system by giving some immune suppressive medication. There are broadly two kinds, that is, one is the steroid, the other one is some steroid sparing medication. Steroids, the dose and the duration of the steroid basically depends upon again the severity of the disease and type of the organ involvement. For example, if you're having a skin involvement or a joint involvement and something like ulcers in the mouth, we may be giving very low doses of the steroid, somewhere around 5 mg or 7.5 mg, something like that. And if you have a severe organ involvement or the vital organ involvement, like the lung involvement or the kidney involvement or the brain involvement, we may be giving you the higher dose of the steroids and also in an IV route. And most of the times the steroids are given during the acute episode, that means that when the disease is very much active or severe. And over some time the steroid sparing medication, which I would be discussing later, that would be added to so that these steroid sparing medication will take over the job of the steroids and will try to control the disease. And the second one would be the steroid sparing medication, which basically includes certain type of medicines like hydroxychloroquine, azathioprine, mycophenolate, cyclophosphamide, tacrolimus, and some biologics like rituximab, Baluma MAP, and so on. So these are the medicines which are given to control the lupus disease, and so that you may not be getting the flares and again, and also it prevents the organ damage. So the type of the medicines that we choose depends upon the symptoms that you have, and also the dose and duration also varies from the person to person and as per the severity.